Once again, Josie, age 11 months, and Andre, age 4, have been left alone for over 24 hours with no adult supervision. Andre has become quite capable of fixing himself and Josie snacks. Both children are filthy. Josie's diaper hasn't been changed in a day, and her crib is soaked with urine and liquid stool. She vomited yesterday, and it is still in her bed. Their mother, Tina, age 20, is a disorganized, depressed woman, an alcoholic who spends most of her time with her boyfriend, who is an addict living in an adjacent building. The children have never known their father. Each year, over 900,000 children are maltreated. 60% of them are victims of neglect. 1,400 of these children die from the abuse. 66% of the deaths are related to neglect. In addition, many childhood injuries can be traced to neglect, even though they are seldom reported as such. A simplified definition of neglect is failure of parents or caretakers legally responsible for a child to provide for his or her basic needs and an adequate level of care. There are 5 types of child neglect. There is physical neglect, in which the parent deprives the child of necessities such as food, clothing, or shelter. There is emotional neglect, in which the parent fails to meet the child's need for affection, attention, and nurturance. There is educational neglect, wherein the parent does not enroll the child in school, keeps her out for non-legitimate reasons, or does not cooperate with special programs or interventions recommended by the child's school. There is safety-related neglect, which includes not using devices such as car seats or bicycle helmets to protect the well-being of the child, or leaving a child unattended in a parked vehicle. This can be deadly, especially in the summer. Furthermore, there may be a gross lack of adult supervision. And finally, there is medical neglect, where the parent fails to provide routine care for the child. In addition, she does not seek services to treat acute infections and often does not seek or continue long-term care for chronic illnesses or disabilities. The types of neglect, of course, are not mutually exclusive. When one type is evident, one or more of the others may also be present. Furthermore, neglect affects all of the children in a family. If one child is neglected, the others may be as well. Neglect, especially emotional deprivation, can occur in any family regardless of ethnic, religious, cultural, or economic affiliation. Most negligent individuals who have been studied by researchers are female. They are primarily single, head-of-household parents who have borne several children at a young age. Frequently, these mothers themselves were neglected as children. Substance abuse is often a major factor. Indifferent is a word that is often used to describe the behavior of these parents toward their children. Although the mothers usually have no wish to hurt their children, they have little capability or enough psychic energy to help them either. One researcher, Leontine Young, described such parents in these words: "The neglecting parents in this study did not plan, so their lives and the lives of their children showed no consistent direction, except for the drift toward personal and family disintegration. What actions they did take were nearly always those impulsive responses to pressures and problems that seek escape, not solution. For the rest, the parents drifted passively, convinced of their helplessness and of the hostility of the outside world." Another researcher found that negligent parents have a lack of knowledge, such as that a baby needs immunizations, or a lack of judgment, such as leaving young children alone for extended periods of time, and a lack of motivation, as manifested by having little energy to learn how to properly care for their children. Some studies show that negligent parents often have lower intelligence, possibly due to their own lack of nurturing and mental stimulation during childhood. Lack of a family support system is also common. The effects of neglect on children vary, of course, depending on their age and the degree of neglect. Infants, the age category most likely to be neglected, often show poor muscle tone, and in later months have problems supporting their own weight, causing delays in sitting erect, pulling to a standing position, crawling, and walking. They are not as likely as other infants to explore their environment or reach out for toys. They often do not look to adults for affection. Frequently, they fail to gain weight properly, have poor motor skills, and delayed language development. As toddlers and preschoolers, these children often continue to be below normal in height and weight. In severe neglect, the child may show signs of malnutrition, such as thin extremities, abdominal distension, and a lack of subcutaneous fat. The skin may be loose and the hair dull. Some infants may develop the non-organic failure to thrive syndrome. In this, the child's weight, height, and head circumference demonstrate a reduction of growth from an established pattern. Although the syndrome may be caused by factors such as poverty, faddish nutritional beliefs, inadequate nutritional knowledge, or family stress, it most often results from disturbed parent-child interactions. In many cases, the parent feels little emotional attachment to the baby and fails to give him any emotional nurturance, and often does not even offer him enough food. This may be because she is unaware of the child's cues that indicate hunger, does not care enough to feed the child properly, or is easily distracted and does not complete feedings. Obviously, such a condition needs to be treated immediately. When treated by professionals away from the home and fed and nurtured properly, these infants often gain up to a pound a week. Even with physical improvement, however, there is debate about the long-term effects on the infant's emotional and cognitive development. Many neglected children will have learning and memory difficulties as well as sleep disturbances. It is also estimated that about 80% of them will later develop conduct disorders such as ADHD, depression, or other mental illness. Furthermore, these children have a high risk for substance abuse and criminal activity, with over half of them being arrested as juveniles and about 1/3 of them being involved in violent crime as adults. Neglected children often suffer from untreated medical and dental problems. Their eyes, hair, and skin are often dull from lack of nutrition. Immunizations are not completed, and the children are not screened for problems such as anemia or elevated lead levels. Their hair and clothing are often dirty and unkempt, and the clothing may be inappropriate for the weather. Pediculosis can be a problem and tends to be persistent, because eradication of the lice requires shampoos and combing, a process that may be beyond the parent's capability or interest. In behavior, these children are frequently passive. They do not reach out and explore their environment as readily as other children, and their language development is often delayed because they are accustomed to hearing one-command statements.
Take your bowl to the sink, Vanessa.
Neglected children frequently have difficulties in school understanding the more complex statements of their teachers.
Vanessa, will you please bring your book and come join us for circle time, please?
Although the neglected child will usually try to comply with as much of the command as she understands, her disregard of the rest of the message may be misinterpreted by the teacher as disobedience. Due to their many problems, neglected children are often unpopular with their peers. Because their communication deficits interfere with their interactions, they are often ignored or neglected in the school environment as well as at home. In summary, neglect can affect children physically, socially, emotionally, cognitively, and be manifested during infancy, youth, adolescence, or adulthood. Christina Appleby, age 5, lives with her mother, stepfather, and an 11-month-old stepsister. Christina's mother, Jennifer, works evenings as a department store supervisor, knowing that her new husband, David, is home caring for the children. For the past 5 months, David has been molesting Christina while her mother works. Jason Talbert, age 8, has also been molested by a helpful neighbor who befriended his mother Deborah and offered to care for Jason while she went back to school. Unaware of his behavior, Deborah is grateful for the neighbor's interest in Jason. Now she no longer worries about Jason spending so many hours by himself after school. Christina and Jason are both victims of child sexual abuse, a topic that is unpleasant to contemplate, uncomfortable to discuss, and as a result, often misunderstood. Simply stated, sexual abuse is the use of a child for the sexual gratification of an adult or older minor. It can be divided into two types of activity or behavior: non-contact and contact. Non-contact sexual abuse includes acts such as exhibitionism, exposing one's sexual organs to the child; voyeurism, observing the child performing intimate activities, such as using the toilet; and showing the child pornography, or using the child in pornography. Non-contact sexual activity can also include verbal sexual harassment, propositioning, and witnessing sexual abuse of another child. In contact sexual abuse, the person touches the sexual parts of the child and encourages the child to touch the person's body. It can involve either penetration or non-penetration activities, such as fondling and kissing. Books and pamphlets designed for children by child abuse professionals help them distinguish between good touch, contact that expresses affection, and bad touch, contact that is sexual in nature. Another element of child sexual abuse is abusive conditions, or the adult's exploitation of the unequal power relationship between the adult and the child. The child may be cajoled into cooperation, as he or she does not have the power to refuse the adult's advances. The abuser, who has the advantage of being considerably older or more mature, is sometimes in a caretaking relationship with the child or in a position of authority or trust. He often carries out the activities against the child using trickery or force. Child care professionals need to be aware of the characteristics of both the victims and perpetrators of sexual abuse, so early identification can be made and appropriate interventions initiated. Although cases of sexual abuse are more commonly reported by girls, it is possible that boys are equally vulnerable, though less likely to tell someone about the incident, especially if they are teenagers. Sexual abuse can occur in children of all ages, from infancy to teens. Abuse frequently occurs in fatherless families, where the mother introduces a series of new partners into the home. Often the child and family are emotionally, if not physically, isolated. Christina's family has few friends, and most of their relatives live in another state. Jason and his mother also are alone, without support systems most of the time. Although reported cases of sexual abuse are identified more frequently in poor families, middle-class and affluent families in relatively stable homes are also affected. In most cases of sexual abuse, the perpetrator is known to the child and family, is a relative, a friend, or a neighbor who often is seemingly liked or trusted by the child. While the vast majority of sexual perpetrators preying on both girls and boys are men, women also are known to sexually abuse children of both sexes. A woman's sexual abuse of a child can often be covered up because she is more involved with child care activities such as bathing and toileting. Generally, the word incest denotes sexual abuse by a blood relative who is part of the child's nuclear family. However, sexually abusive individuals who act as a surrogate parent, such as a stepfather, may be included in some functional definitions of incest. The term intrafamilial may also be used for those not related by blood. When there is sexual abuse by a family member, the offender can be a stepfather, biological father, brother, uncle, or grandparent. In an incestuous situation, the oldest daughter is frequently singled out as the target. When a perpetrator is known to the child, authorities have described 5 phases of sexual abuse. Not all cases, of course, follow this exact sequence or are clearly delineated. The first phase is engagement. The abuser has access to the child, engages him or her in verbal interactions, and conveys to the child that the behavior is acceptable. Some refer to the adult's activities as grooming the child. To make his point, the abuser often misrepresents moral and behavioral standards. Abusers often exploit children's needs for adult approval and affection, love of games, and interest in material awards such as money or presents. Often the perpetrator attempts to make the child feel indebted or obligated because of the gifts or the gift of affection. Perpetrators are aided in all of their efforts by the children's awe of adults, desire to please adults, and recognition of their own powerlessness. The next phase is sexual interaction. It may vary from non-contact abuse, such as the person disrobing in front of the child or exposing genitals, to different non-contact sexual behaviors to see how the child reacts. As the abuse continues, it often progresses to more physical contact, such as penile penetration. Sometimes the child is intimidated and forced to engage in a sexual act. In the secrecy phase, the perpetrator uses his power to dominate, bribe, threaten, or emotionally blackmail the child to keep the secret and possibly continue.
Okay, now, Jason, you gotta keep that a secret, okay? It's just between the 2 of us, all right? Now, your mom won't let me bring you any more toys if you don't keep that a secret, okay?
The next phase that may or may not take place is disclosure. The abuse is discovered because the child tells an adult or friend, a third party witnesses the abuse, or the child shows physical or emotional indications of abuse. For some victims, the disclosure phase may not occur until they reach adulthood. The final phase is suppression. During this time, those close to the child often encourage or even compel the child to forget the abuse or to retract her previous accusations.
I don't want you to tell anybody this.
The motivations for suppressing the child's story vary. There may be fear of scandal or stigma, disgust or abhorrence of the reported act, or fear of the consequences. Parents may lash out at the children and accuse them of stupid behavior or having a dirty mind. Girls may be asked, "Why did you let him?" They may be charged with sexually provoking the abuse. For if the child is to be believed, the family is placed in a terrible crisis. In the case of incest, the mother may have to end a significant relationship through divorce or separation, with all the resulting emotional turmoil as well as financial loss. Sometimes, as a result of the terrible crisis and the desire to keep the family intact, the mother becomes an accomplice to the sexual activity by refusing to believe the child or actually facilitating the abuse. If a non-family member is the perpetrator, the family may feel intense guilt because they trusted the person. In almost all cases, the family suffers from feelings of shame. It can be seen then that sexual abuse itself is only one facet of the trauma experienced by these children. They are lied to, manipulated, forced to act against their will, bribed, threatened, and then often disbelieved by those whom they trust and in many cases depend on for love and protection. They are betrayed. Detecting childhood abuse can be difficult, especially in the very young who usually cannot express themselves clearly. Also, many sexually assaulted children have no evidence of physical injury, even when penetration has occurred. There are, however, some physical and behavioral signs that suggest sexual abuse. The word suggest is used because the signs may be caused by conditions other than sexual contact. One physical sign is unexplained genital injury. The child shows evidence of anal or genital bruising, tearing, stretching, or bleeding. Another physical sign is a sexually transmitted disease. This may be manifested by a foul-smelling, greenish discharge from the penis or vagina, vesicular lesions, that is, sores with tiny blisters containing clear fluid, or genital growths. A third physical sign is pregnancy, especially in young teens or adolescents. Behavioral signs that may suggest sexual abuse include the sudden onset of the child acting out sexually. This includes inappropriate sexual play, extremely seductive behavior, and excessive or public masturbation. In addition, the child may use language or words that are sexually explicit and beyond his level of development. The child may also show withdrawn behavior, such as increased daydreaming or preoccupation with fantasies. There may be regressive behavior, such as reversion to thumb-sucking. Sleeping and eating difficulties may arise. This sudden onset of fears of men, strangers, or a location such as the babysitter's home may also be suggestive. It should be noted that some of these signs can be present in other conflicts as well, but nevertheless, sexual abuse should be a consideration. Child care professionals should listen carefully to children's comments. Suspicion should be raised if a child definitely does not want to be with a particular person or be in a particular setting, such as a neighbor's home. Because, as quoted earlier, young children do not have the vocabulary or the language skills to discuss facets of sexual abuse, comments by a child such as that an adult does funny things with them or touches or feels them should be gently explored.
You said your grandfather does funny things to you? What kind of things does he do?
Comments by a child that an adult likes to photograph him should also be noted. The effects of sexual abuse on children depend on several variables. The most important is that the children were believed by the first person they told. If the child is disbelieved, forced to recant, or made to feel ashamed or blamed, the abuse is likely to be more traumatic. Other factors include the protection the child received after disclosure, and whether or not he or she received therapy right away. The age and underlying personality of the child, of course, are important factors. Although some seem to recover from the experience of child abuse without any ill effects, that is generally not the case. Children need to fulfill their sexual development in an orderly, sequential fashion, and sexual abuse disturbs this normal pattern. Abuse that continues for a period of time, rather than a one-time occurrence, can be more traumatic. In families in which incest occurs, the abuse usually continues for 1 to 3 years before disclosure.
So we're going to play some games now. But to do that, we have to go in the back. Can't play them out here in the kitchen.
The extent of the abuse is also a factor. Abuse which progresses to more contact or does more physical damage to the child can cause more residual effects. Understandably, sadistic or violent behavior by the perpetrator is also more traumatic. Current educational efforts to protect children from sexual abuse has centered on teaching them to protect themselves by saying no, to recognize their right not to be touched in private places, and to tell responsible adults about a sexual overture. Although these efforts may provide some protection, it is obvious that children are no match for predatory adults with superior knowledge, strength, cunning, and the authority of age. And if children taught these skills should fall victim to a perpetrator, they may feel great guilt that they were not able to protect themselves.
I'm going over to the park if you want. I can take Susie, take her on the swings, merry-go-round, one of those jumper things.
I think we're kind of having a girl day here.
Adult caregivers, therefore, must be aware of those who are around the children. Pay attention to intuitive feelings that a situation could be potentially dangerous. Listen carefully to children's comments, especially those that may indicate anxiety or fear, and encourage children to ask for help in uncomfortable situations. Open communication between responsible adults and children reduce the chance that the children will be victims of sexual abuse.